So thank you everyone for coming out today. Pretty big occasion to celebrate some working across jurisdictional boundaries. Something that in the fire service we pride ourselves on, but bringing together the level of management folks, law enforcement, hospital systems. So to give you a brief introduction, my name is Steve Pincus. I am the EMS Planning and Emergency Management Coordinator for the PIMS Council, Peninsula EMS Agency. And to give you a little background about PIMS, we are a nonprofit corporation and we assist the local governments, hospitals, EMS folks, and healthcare providers throughout the entire region. And the region runs not only Hampton, Newport News, York County, James City County, Williamsburg, but it also includes agencies from the Middle Peninsula and the Northern Neck. So basically we go almost all the way up to Richmond. So on behalf of the council staff and the board of directors, we have 16 counties and cities, 10 hospitals, 58 EMS agencies, and well over 2,800 EMS personnel. And when you count in the number of physicians that we deal with and the nurses from the EDs and other healthcare providers, I am very privileged to announce that you all are the recipient of a brand new award that has been established through the state. And that is the 2020 Innovation Excellence in EMS Award. Now, I'd be remiss if I didn't acknowledge the people who sponsor us. So each one of the localities help us with our fundings, along with the hospital systems. Riverside does it, Centera, and Bon Secours, and VCU. So they help us to be able to do our jobs and to help assist you all as agencies. So this particular award, the Innovation Excellence in EMS Award, it recognizes people who exemplify innovative excellence in the advancement in the statewide Virginia Emergency Medical Services system. And the COVID-19 Operations Center, otherwise known as a PCOC, they really went above and beyond. Early on, the PCOC was formed in around mid-March or so. And it served as an incident management team so that we could share information at all levels of government with all the different agencies who may be involved in dealing with the pandemic itself. And as this pandemic really started to affect our region, it was important for us to not only share information about what was going on, the number of cases involved, but some of the different things that we had to adapt to deal with the actual pandemic itself, such as a new way of providing PPE for each other when we had limited resources, decontaminating our ambulances, and this all was highly coordinated through the PCOC. And it served as a collection point as well for data that we might may not have necessarily received otherwise. Virginia Department of Health was instrumental in doing it. Your local health districts really played an important role to make certain that we got the information that we needed and that it was disseminated across jurisdictional boundaries. You know, oftentimes in the EMS world, yes, law enforcement may respond with us to some of those domestic violence situations and other calls that may involve the law enforcement, but you never really thought of a pandemic actually affected them. And oftentimes the officers had that one-to-one contact with individuals who may have been a carrier of the COVID-19. So it was important on bringing them in. just to give you a list, we had county and city administrators, the city managers, Virginia Department of Health, our law enforcement, including the sheriffs and police, our area hospitals, Centerra, Hampton Careplex, Riverside Regional Hospital, Bon Secours, Mary Immaculate, our local military partners, Riverside Doctors Hospital, Centerra Williamsburg Regional Medical Center. Of course, PIMS was involved as well. We actually had to come up with some guidance on responses, so to try to keep our responders safe, and so that we wouldn't be the ones who would be spreading the virus. Today, the Peacock still operates virtually. Every one of you, I've heard you on a phone call on a weekly basis. And in the beginning, sometimes we're meeting more often than that. Without the support and formation of the Peacock and the idea that finally blew up into this multi-cooperative support system, the local agencies would have just been left to fend for themselves. And so we are very proud to celebrate what the Peacock has done for our region, what they've done for EMS. In fact, Middle Peninsula and Northern Neck did a similar action based upon the model that was set up here amongst all you agencies. So on behalf of the president of the PIMS Council, that's Julie Glover, the entire board of directors, and our staff in the entire PIMS region, I congratulate each one of you on this achievement. We have submitted it up to the governor's office. We think that the model that you set in place here could be a statewide model or even a national model for cooperation when we come to similar events like this. So I congratulate you each on your contributions to this, because it took many people researching, finding out what worked, what didn't work, where our hot spots were, what we could do to protect one another. It took a really collaborative effort, and you really did an outstanding job. This is something that we never thought that we would face to the degree that we did. So just a little bit about the award process. The awards are nominated in individual regions. So in the PIMS region, many people will nominate different individuals for different awards. There is a body of people, a committee, who actually takes the various nominations and evaluates them. And they were just overwhelmed with positive accolades for what took place with the Peacock. So again, congratulations on behalf of the PIMS Council, and I'll go ahead and start presenting the awards now to each of the cities. So if the members from James City County will come forward, we'll present them with this. On behalf of Tim, congratulations and job well done.
Thank you.
And if you can share that with the law enforcement, things like that. Is anyone from Williamsburg here? Good. Chief, on behalf of PIMS Council, congratulations for this award and thank you for all your contributions.
Thank you.
City of Newport News. Chief and Mr. Archer, on behalf of PIMS, congratulations. This has really been a special thing, and thank you for hosting it at your EOC to begin with. Thank you very much. Congratulations.
Thank you.
York County on behalf of PIMS, we present this to York County, and we're glad that the law enforcement component is here as well. Congratulations, job well done.
We all listen to Shelley.
That's right. That's right. City of Hampton. So on behalf of PIMS, congratulations to the City of Hampton. Job well done, and we hope to continue up this level of cooperation. Thank you. Is anyone here from Pocosin? Pocosin folks make it out? Our representative from Bon Secours, Mary Macklick. Just on an aside, our hospital systems actually helped us out tremendously, both with counting the number of cases that were not only under suspicion and what their status of was in their ERs and in their ICU units, how many respirators they had, and just helping us with pretty much a broad spectrum of things that we needed, including decontamination procedures as well. Congratulations on behalf of PIMS. Thank you. Yes, sir. Is anyone from Centera? Joint Base Langley Eustis?
Yes, sir.
So oftentimes the military component was kind of on the outskirts, but to have them involved in this operation to let us know what was going on the bases was a tremendous amount of help, sharing information with each other. So on behalf of PIMS, congratulations.
I appreciate that.
Thank you, sir. Anyone from Navy Regional Mid-Atlantic? How about the Hampton or Peninsula Health District? Centera Williamsburg? Riverside Doctors Hospital in Williamsburg? Congratulations and thank you very much. As you know, up in the Williamsburg area, that was kind of like our first hot spot, and you know, watching the developments there, it did help us to learn a lot of lessons from what was going on there. So we appreciate your participation. Anyone from Hampton VA Center? come back over here. So again, we have submitted the Peacock, or the Peninsula COVID Operations Center. We have submitted all the information about what you all have done up to the state for a potential governor's award. And we're also trying to make certain that they know how this model worked and what benefits the whole region derived from it. Again, congratulations, and thank you very much for all of your support.